Pre-hospital care for patients with COVID-19 requires a careful balance between rapid assessment, effective treatment, and strict infection control to protect both patients and healthcare providers. Emergency medical services, EMS personnel, must follow established protocols to minimize the risk of transmission while delivering appropriate care. When responding to calls, EMS teams should screen for COVID-19 symptoms, such as fever, cough, shortness of breath, and recent exposure history, ideally before arrival if possible. Personal protective equipment, PPE, including N95 or equivalent respirators, eye protection, gloves, and gowns should be donned prior to patient contact. Proper donning and doffing procedures are essential to reduce contamination risk. On scene, limit the number of responders in direct contact with the patient. Maintain physical distancing when feasible, and use surgical masks for patients if tolerated. Oxygen therapy should be provided as needed, but aerosol-generating procedures, such as nebulization or non-invasive ventilation, should be avoided unless absolutely necessary, due to increased risk of airborne transmission. If airway management is required, use the most experienced provider to maximize first-pass success and minimize exposure time. Monitor vital signs closely, with attention to oxygen saturation and respiratory status. Transport decisions should consider the severity of illness, comorbidities, and local hospital capacity. Notify the receiving facility in advance of a suspected or confirmed COVID-19 case to ensure proper isolation measures are in place. After patient transfer, EMS providers must carefully remove PPE and perform thorough hand hygiene. The ambulance and equipment should be disinfected according to infection control guidelines before returning to service. Throughout the process, clear communication, adherence to protocols, and ongoing training are crucial to ensure the safety of both patients and healthcare workers during pre-hospital care of individuals with COVID-19.